welcome to your classic cranial nerve exam. Can I start off with your name? Okay, and what is the reason for coming in? You bumped your head? Okay. Tell me a little bit about how that happened. You fell down the stairs. Okay. And when was this? A couple hours ago? Okay. Why didn't you come in right away? You didn't have a ride here? Okay. Well, I'm glad you came when you could. Yeah, unfortunate that you weren't able to come right away. Are you feeling dizzy at all? Okay. Can you see my fingers here? Okay, very good. And are you feeling nauseous at all? Okay. And are you in a lot of pain? On a scale of 1 to 10, how bad is it? Okay. You see the pain is right over here? Okay. Alright, we'll definitely do a cranial nerve assessment. We'll start off with your vitals, and we'll check your height and your weight. And then we'll get started. Did you bump your head anywhere else? Or sorry, did you bump yourself anywhere else besides your head? Your shoulder? Okay, I'll take a look at your shoulder as well. And other than that, you're fine? Okay, good. Alright, let me go ahead and put on my gloves. Okay. And are you able to tell what color my gloves are? Purple. Very good. So, like I said, we'll start off with vitals, height, and weight. So what I'm going to do is I'm just going to have you step on the scale right there. Yep, right over there. Just step on the scale. Perfect. Okay, so you are currently 145 pounds. And just tell me really quick, when's the last time you weighed yourself? Okay. Has your weight fluctuated at all? No? Okay, very good. And let me just measure you, okay? So I'm gonna go ahead and measure you. Okay, so just stand tall. I'm gonna measure from the top of your head, right here, down to your toes. Okay, so it looks like you are about 5'7", okay? And I'm just going to measure you this way as well, if you put your arms out all the way from finger to finger. 5'7", yep, exactly, okay. Let me just write that down really quick so that I have that in my notes here. Okay, perfect, thank you for that. And now I'm just going to set this aside. So I'm going to have you just sit down on that table for me, if you could do that. Perfect. Start off with checking your temperature just to make sure you're not sick or have a fever, infection, or anything like that. So let me just go ahead and okay, 98.5, which is normal. And can you give me your finger? Perfect. I'm just gonna stick your finger in here and check your oxygenation. Just relax for me. Okay, looks like it's 99, and then the BPM is 92, which is normal as well, so we don't have to be worried about your vitals there. Next up, I will be taking a really quick look at your heart and your lungs, okay? So I'm just gonna have you breathe normal for me. Okay, good. Breathe in, breathe out, and breathe in, and breathe out. Good. And again, breathe in, and breathe out. And one more time, breathe in, and breathe out. Okay, so I don't hear any crackling in your lungs, and your heart is beating strongly, so that's good. All right, so now we're going to move on to just doing a really quick throat swab. When is the last time that you had like swollen tonsils or anything like that? Okay, so you're not sick at all. All right, let me just double check your throat here. Okay, it doesn't look like you have any swollen tonsils or any signs of infection there, so that's good. We can clear you for that. Perfect. And stick your tongue out. Good. And again. Good. And just gonna tap, push down, and do the gag reflex. Okay, perfect. Now we're gonna focus on your trochlear nerve, which is your optic nerve in your eyes. Just gonna make sure that your cranials in your eyes are working properly. What I'm gonna do first is come really close and take a look inside your eye to take a look at the optic nerve, okay? So I'm just going to taking a look at the optic nerve. Just going to be and to say that the optic nerve is intact and is healthy. There's no popped blood vessels or anything like that, so that's good. I'm gonna check this side here. Okay, so it doesn't look like there's any popped blood vessels or anything like that. And I'll have you look up for me, please. I'm just going to go ahead and push down on the eyelid here. Okay, very good. All right. Okay, so from my understanding, it looks like your eyes are very healthy. We're going to do a few eye tests though first. So what I'm going to do is I'm going to have you look at the chart here. Okay, tell me what letter this is. Good, what letter is this? Good, and this letter here. Good, this letter here. Okay, and this letter here. Good, this letter here. And this letter here. And can you read the bottom line for me? And are you able to tell me what color this is? And what color is this? Very good. And point to the circle that's the smallest. Okay, and point to the circle that's the biggest. All right, we'll be testing your color vision next. I've got a few different ways we'll be doing this. And so first off, I'll be showing you color pages. All right, so tell me what color this is. Good, and this. Good. Blue. Now we'll be showing you the same colors over and over again, but don't be alarmed, just let me know what colors they are, okay? Very good. Good. Okay. All right, now I'm going to show you a series of markers, and I want you to say yes or no. So I'm going to say, is this a certain color? And I just dropped one of them. I'm going to say, is this green? And if it's green, you'll say yes, but if it's not green, you'll say no, okay? All right, let's get started. Is this red? Is this green? Is this green? Is this brown? Is this purple? Is this blue? Is this blue? Is this pink? Is this red? Is this pink? Is this green? Is this orange? Is this red? Is this yellow? Perfect. Okay, so now what I'm going to do is I'm going to switch them up really quick, okay? Alright, so you can tell that this should be orange and this should be yellow, right? So I know this is going to be a little bit confusing, but I want you to follow what color I say and you'll look at the top, okay? Alright, so let's go ahead and get started. I want you to follow the yellow and ignore the orange, okay? Follow the yellow and ignore the orange. Okay, now look at my nose and ignore both of them. Alright, now look at my right eye and ignore both of them. Good. Alright, now I'm going to have you look at the orange, okay, and ignore the yellow. Just follow the orange and ignore the yellow. Now look at the yellow. Now look at my nose. Now look at the orange. Alright, we're going to do this one more time. I'm just going to switch them back because I have OCD. Alright, so let's do two different colors here again. We're going to do brown and we're going to do blue. So we're going to switch these two up here. Okay, so once again, you are following what the top color is, okay? Let's get started. So I want you to start off by looking at my nose and ignoring both of the colors coming into your vision. Alright, now I want you to start looking at the brown and just ignore my eyes, ignore my blinking eyes. Okay. All right, now look at the blue. Okay. And I want you to continue looking at the blue. All right, now I want you to look at the brown. Look at the brown. Good. Look at the brown. Okay, look at my nose. Okay, now look at the blue. Look at the blue, look at the blue. And now look at my right eye. And now look at the brown. Now look at the blue. Now look at my nose. Now look at the blue. And look at the brown. Very good. All right, we're gonna put these back because I have OCD. All right, let's move on to the next phase of the eye examination. This would include a few different cards. And so with these cards are colors, shapes, food, animals, stuff like that. So first of all, I'll have you tell me what color is this anchor. Okay, good. And what animal is this? And what color is he? Brown. Perfect. I want you to tell me now, because this is a fruit, I want you to say if this is one of your favorite fruits, because it's one of mine for sure, okay? Would you say this is one of your favorite fruits? Sorry about the truck there. Would you say yes or no? Okay. And now, I want you to tell me what color these lips are. Pink, 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 pink. Is pink your favorite color? Okay. What is this? A circle. You're doing great, by the way. I am not worried about your trochlear nerve. I think that it's working perfectly fine. But let's keep going. A few more cards here. And what color is the cone? Good. And would you say that an apple a day keeps the doctor away? Have you been eating an apple a day? Or you wouldn't be here. Okay. Now I want you to tell me what this is. It's a jar, right? Right. A jar. Now I want you to tell me what shape this is. Square. What color was the square? Is the square the same color as the triangle? Yes. Perfect. Okay. And what is this? A star. Good. And what color was the star? All right, now tell me, is this your favorite animal? A dog? Are you a dog person or a cat person? What color is a dog? Brown. I'm a cat person. Yeah. Dogs bite. Okay. Now tell me, is this ice cream? Does it look like an ice cream sundae more so? It does, doesn't it? I feel like they should have put ice cream sundae on the card, personally, because it looks more like a sundae to me. All right, now things are gonna get a little bit harder, okay? Tell me, what shape is this? Octagon. Good job. Okay. This should be easy. You use these in school. What is this? A pencil. Exactly. Okay, here we have another fruit. What is this? Easy, right? An orange. And what color is it? Orange. Yep. You did a good job. All right. So now, what we're going to do is we're going to do a really quick check of your nose. And I just want to make sure you don't have a deviated septum or anything like that, okay? So I'm just going to have you look up for me, if you would. Just to take a look inside your nose here. So I'm just taking a look inside the nose. I don't see a deviated septum, which is good. I don't see any scabbing or any scratches. Okay. How's your smell been lately? Pretty good? All right, let's go ahead and take a look at this side here. Okay, so no deviated septum, no scabbing, no scratches or anything like that, no discoloration. Okay, all right. I'm gonna bring this back down if you're okay. Bring your head back down. All right. Are you nauseous at all? Okay, good. All right. Well, let's get started with a very simple smell test. So I've got a few tinctures here, okay? I've got 3 tinctures and then I have a few glow sticks and they are scented, okay? So let's get started. What does this smell like to you? Cherry pie. Good one. And this one? Apple pie. And this one? Grape juice. Yes, okay. Now I have 2 different glue sticks here. They're both scented, okay? Sorry, it looks like your head is a little, okay, there we go. They are scented, so just go ahead and smell that for me. Any ideas what that smells like? Yes, mango, pineapple. Okay, let's try this one here. Yes, watermelon. My favorite, my absolute favorite. Doesn't that smell so good? Sad that summer's over because I love watermelon so much. I have watermelon almost every day in the summertime. I do have one more tincture here I want you to smell here. Rosemary? Yes, exactly. It's like a rosemary hint of mint. All right, so let's move on to, we already checked your mouth, but I do want to actually just double check that there's no broken teeth. So let's just take a look. If you could just say, I just want to make sure there's no broken teeth. Okay, good. Can you actually close your mouth? Okay, go like this. Yes, I am wearing Invisalign, yes. Okay, smile for me. I'm gonna actually just do a really quick check of your teeth, okay? I just want to make sure that they're not chipped or anything like that. So if you could just keep your mouth open there. .2 and 3.4, A7, 4.3, 5.4, which is 2.3, 5 on the outskirts of 2.4, and the outskirts of 3.2, and taking the top left, which is, okay, we're just tapping on the teeth here, making sure that there is no way you could have cracked a tooth while you were falling. Okay, your teeth do seem sturdy. I do want to just take a look at your tongue. So I'm just gonna scrape the tongue. Okay, doesn't look like there's too much coming off the tongue, so you don't have to brush or anything, which I didn't think you did, but I just thought I would double check. But let's go ahead and do a really quick taste test, okay? So we're gonna start off with this flavored liquid here. Okay, just try that. Okay, good. We've got one more here. Okay, so I'm just gonna have you try that. Right, how does that taste like there? Correct, yeah. Blueberry. Okay. And then I have a few foods for you to try. So I want you to close your mouth, okay? Because I have a few foods I want you to try. So just, I'm sorry, I mean close your eyes. Okay, so let's just, okay, take a bite of that. Chew that very well. And what does that taste like? A burger, was it good? All right, now we're gonna try one more thing here. Take a bite of this. All right, what does that taste like? Sushi. All right, tell me what this tastes like here. Also sushi. Okay, and then last but not least, yes, fries. I agree. I feel like they need ketchup too, in all honesty, but I don't have ketchup here. Okay, so you're doing really good so far. I'm gonna check your ears now. Okay, so I'm just gonna have a feel of them. Any discomfort? Any pain? Just gonna pull this ear back. Okay, and I'm gonna pull this ear back. Any pain? Okay, let me go ahead and take a look, okay? Alright, so I'm just gonna have you turn your face this way a little bit. Alright, so I'm taking a look inside the ear. I do see the tympanic membrane is pro-gray. There's not too much earwax, which is good. Looks like you take really good care of your ears. Looks like you cleaned them really well. Sorry about the truck there. Okay, and I don't see any abnormal discharge. So sorry about the truck there. Okay, I don't see any abnormal discharge. Alright, let's go ahead and check the other one really quickly here. Alright, so just taking a look into this ear here. Alright, looks like you've got not too much earwax. Tympanic membrane is pro-gray. And no abnormal discoloration or signs of infection or anything like that. Okay. So there wasn't enough trauma in the head to make your ears bleed, which is good. Like, we don't want there to be trauma like that, right? So I'm going to do a really quick ear examination test. Okay, so we're going to start off with just like my hands here. So just tell me which ear you hear. Good. Okay, so now I'm going to make this sound. Can you hear this? And this? Okay, so I want you to close your eyes. Actually close your eyes, okay? Are you closing your eyes? Good, okay. Which ear do you hear this? And now? Keep your eyes closed. How about now? And now? And now? And what about now? And now? The last one was more in the middle of your face. Okay. Do you hear the clicking? Okay. So there's this clicking, and then there's this clicking. This one is a little bit more on the faint side, wouldn't you say? So this would be number 1. This will be 2. Okay. So I want you to close your eyes again. Tell me which one you hear, 1 or 2. You did a really good job keeping up there. I'm so proud of you for that. You're amazing. Now we're going to do stapler and hole puncher. Okay, can you tell the difference? Stapler, hole puncher, stapler. Got it? All right, so hole puncher will be 1, stapler will be 2. Sounds good? So tell me which one you hear, 1 or 2, and I want you to close your eyes again. Make sure you close your eyes. Are you closing them? All right, here we go. All right, you did a really good job keeping up there. We're gonna move on now to you guessing sounds, okay? So you don't have to close your eyes for this if you don't want to, but I want you to guess the sound. Good job there. Those are scissors. Now I want you to guess this sound here. Spray. Okay, and guess this sound here. Water, exactly. Would you have any idea what I have in my hands right now, though? What are they called? Water globes, exactly. Good job. All right, so we're gonna do one last ear test where I whisper something into your ear and you repeat it back to me. Sounds good? Fall. Pumpkin spice. Iced latte. Leaves. Cozy weather. Warm fireplace. Wonderful. You are just immaculate. I cannot express how amazing you are. So now we're going to move on to testing your sensations. And what I'm going to start doing first is just having a feel of your face. And really, I do want to just feel it if you have a bump on your head. So you don't. Seems like you don't really have a bump on your head, which is good. Let me just take a light and look here. Okay, so it doesn't look like you have a bump on your head. Very good. Some must have just been a really minor fall, hey? Do you think it was just a minor fall? Good. Okay, so let me just tap on your face. Let me know if you feel any pain. Okay, you want me to take a look at that shoulder there, right? Okay, let me take a look here. Okay, there's no bump there. It's just a little bit sore. All right, well, I'm sure it'll be healed in a couple days. Just make sure you get lots of rest. So now I'm going to palpate on your face. Let me know if you feel any pain. Very good, I'm glad you've got no pain. We're gonna move on to sharp or dull. So this is sharp and this is dull, sharp, dull, sharp, sharp, dull, sharp. Does that make sense? Okay, we're gonna start off with sharp. Okay, good. Dull. Okay, now I want you to guess which ones they are. Make sure you close your eyes. Good job there. We're gonna move on to sharp or dull one more time. This will be sharp and this will be dull. Okay. Very good job so far. Very good. All right, you did an amazing job, honestly. You have passed your cranial nerve exam. Now I'm just going to move on to very quickly writing down all of my notes. So all of your cranials are intact. I'm not worried about any broken blood vessels or anything like that when I'm looking into your eyes. And your ears seem fine. There's nothing going on with your ears. Everything seems fine there as well. Your sense of taste and your sense of smell was 100%, so you did a really good job there as well. Not worried about your taste or smell. And then your eyesight was actually pretty amazing as well. There was no discoloration in your eyes, so that's great. And then your height and weight, we've got that written down here for a future visit if you do come. So yeah, just probably get lots of rest if you can, and I'd make sure to come back if you start to feel nauseous or anything like that. All right, well, thank you for coming in and have a great day. Feel better, okay?